My name is Sophie. I suffered from fibromyalgia and extreme fatigue syndrome for about 24 years. Today I'm fully healthy. And now I would like to pass on everything I've learned about health and healing and more to support those who are still on a journey. And this is why I create this documentary series and podcast, The Puzzle of Healing.
Welcome everyone to a new episode of The Puzzle of Healing. This episode is not only very special because we actually filmed it in English and in German. It is also very special because I get to introduce you to Marco Leitzke, a medical professional who conducted a study with nicotine plasters to figure out if they can help long COVID patients. And what he found is that it can help long COVID patients and ME CFS patients to reduce or even eliminate the symptoms. In this episode, we talk all about it, we tell you how to do it, and I can't wait to dive in. So let's go. Hi Marco,
Hey,
nice to have you here.
you.
We just had the whole thing in German and now we're going to try a condensed version of your incredible nicotine
I'm pleased
study
as well.
in English.
Hello.
Amazing. Do you want to quickly say who you are and what this study is about?
Okay. I'm actually working as an anesthesiologist. That means everybody knows what an anesthesiologist does. Furthermore, I'm an investigator, a researcher in the field of cholinergic neurotransmission. It's a quite narrow field, but it seems to be enlarging the next month and years. So, yes, that's my profession.
And you did a study with nicotine on long COVID patients, which has also a positive effect for people with ME CFS. How did that come about?
As I already said, I'm investigating in cholinergic neurotransmission, especially with a target or with a goal to find a solution for the people with septic shock, especially, which means I saw a very similar behavior of the body along the acute COVID infection, where we see dramatic causes with multi-organ failure and injury, death, with people actually being healthy before the infection. And what I saw were parallels between the cause of septic shock and the acute COVID infection. And that brought me to the investigation, which are the parallels between submolecular instances of the acute infection. And so I found out that especially the so-called cytokine storm, which means that pro-inflammatory cytokines are revealed and liberated in a very large amount along these severe causes of sepsis, like COVID, acute COVID as well. And that was a trigger for me to find out what is about these incidents as comparable incidences. Yes, and I made a publication, I guess 2020 or 2021. And afterwards we saw that a lot of patients won't come out of the misery even after healing from a COVID infection, and found themselves in a sickness, in a condition which is called a post-COVID condition or post-COVID syndrome or long COVID, with a terrible plethora of symptoms which are non-referable to any other disease and especially not measurable by any biomarker. And yes, and I thought it must have been something wrong with a cholinergic neurotransmission. And when I read a paper from Mr. Jean-Pierre Janjou from the Sorbonne in Paris, which showed up that the special so-called PRRA motive, a special motive within the DNA of the spike glycoprotein, is more than suspected, similar to so-called cholinergic poisons. So for me, it formed or I became convinced that this must be the core of post-COVID syndrome. And because these receptors are nicotinergic receptors, it was quite a short step to find the possibility to get the receptors rid of this blockage from SARS-CoV-2. Yes.
That is, to me, that's an incredible jump. I mean, if you're working in the field, it might be more easy to make that sidestep. One thing we just talked about in German as well, really important to know, as you said, there might be some negative preconceptions because people see smoking as the same as nicotine. So it isn't. Smoking and nicotine plasters are very different.
Very important. The substance itself is often compared with smoking and to be the same matter, which is wrong, definitely wrong. If you smoke, you inhale just once. By inhaling, you would take a very, very large amount of nicotine to your body. You ingest a large amount to your body, which evokes very high peak levels within your blood of nicotine. This is first the reason for eliciting addiction. Thank you. Listening addiction. Furthermore, everything what is known about smoking, like being cancerogenous, being cardiovascular compromising, is not due to nicotine as a substance, but more likely to all the other, about 7,000 substances which appear along smoking by burning tobacco and paper. So this is of critical importance that people understand that nicotine could be used as a medication without smoking it, and especially in the case of post-COVID, due to the very special configuration of the receptors and their dynamics with binding and unbinding, we need a constant low level of nicotine within our blood during the treatment, which is not given if you try to smoke. But on the other hand, one must say that probably smoking has a kind of preventive effect to post-COVID syndrome, because more receptors are blocked by, or not blocked, but are bound by nicotine along smoking, and so the possibility that a lot of receptors get blocked by SARS-CoV-2 is diminished somehow. But this is not 100%.
Yeah.
So even smokers can get post-COVID, of course.
Okay. And wasn't there also something that people who smoke are more likely to suffer stronger from COVID because of their lungs, who have already packaged basically, or am I remembering that incorrectly?
Of course, this might be, because all the poisons one inhales with smoking a cigarette are probably promoters of a bad cause, of a very hard cause of the COVID infection. So I never would advise anybody to try smoking for any reason connected to his health. But this is, of course, nonsense and rubbish. But yes, smoking is no real alternative. Like chewing nicotine gums and other applications are not really that effective, like the transcutaneous application via a patch.
And if people now want to try this, what do they need to bear in mind when they go and do it? How does it work?
First of all, most post-COVID patients I know are nicotine naive persons. That means they had never had been in contact with nicotine. And that means that the first contact feels like the first cigarette they ever smoked. That means nicotine evokes a lot of side effects, like diarrhea, like nausea, vomiting, vivid dreams. And this is to be expected when I start with nicotine as medication. Second, when I go to my hypothesis that nicotine liberates the virus from this binding of the receptors, then it's clear after application of nicotine, the patients will experience so-called viremia. It means that the virus is anew within the blood of the patient, and the time span until the immune system is reacting, what it does for sure, is reacting with antibodies, could take between 3 and 5 days. So one must expect a situation which is very comparable to an acute infection. But all the patients I saw until now, didn't find themselves within the new acute infection. This is a critical importance that nobody has to feel frightened from the new infection, which is going to take to bring out all the problems which they had before COVID, or before long COVID, especially.
Yeah, and so you said earlier, so you do it for 3 days in the lowest amount to get your body used to it. That's the first step, right? How does it continue?
To people who never contacted nicotine, they should use a minimal patch. The lowest dosage which is available is 7 or 7.5 milligrams per 24 hours. And this is even too much for nicotine naive persons. Therefore, it's very advisable to foil the half patch with a plastic foil, for instance, and to use for 3 days the 3.5 milligram dosage, and to accelerate after that to 7 milligrams. The 7 milligrams should be pasted for about 7 days, so that we find the first application trial with 10 days. After that, it should be made a pause, an interruption, because the nicotine receptors become desensitized after low-level continuous stimulation. After these 10 days, along the interruption, people should feel how they feel like how everything developed, and they could consider and decide after 7 days might be to make a new trial. If they feel improvement, they should give their body the chance to go up for this improvement and to find his own balance without nicotine. And if they feel after improvement along the pasting the patches, and after stopping the patches, it decreases once again, they could make another trial. The thing is that the nicotine patches are very affordable, they are not very expensive, so it is worth to make another trial. Yes.
And you said it is very important not to cut the nicotine plaster if you want the half doses, just cover half.
We call it galenic. That means how is the patch produced. And if you cut it, I know that in the United States there are some patches which are dividable, but within Europe such patches don't exist. So it is of critical importance not to cut the patch, because then the nicotine dosage you're given within 24 hours is not really controlled. Could be less, could be far too much.
And now to the amazing part, because there is an entire online community who shares their success, what's going on. What did you see since your study?
We saw meanwhile a lot of patients came up to my publication, which appeared in 2023 this year in 18th of April. With bioelectronic medicine, and they came up to the study, and they read and guess they understood what was written there, and they tried it themselves. And so I got a lot of feedback and information. And once, especially a Norwegian sufferer guy, activist, began to start a campaign, an international campaign. Meanwhile, it's translated into 26 languages, Korean,
That's amazing.
Turkish, Spain. Yes, and meanwhile, a lot of people try out, and the thing is that this swarm intelligence gives day by day new experiences, even to me, and so we build up a treatment protocol, which is available on Twitter under hashtag the nicotine test, or on the Facebook with the same hashtag. And these groups are filling themselves and filling the platform with very important information, and we get day by day a little bit more experience, a bit smarter in doing the nicotine test. Yes, and we saw
so
amazing courses. I got to know or was in contact with a female patient, which described that after 9 weeks, 9 weeks after finishing nicotine, she's now able to drive with her home bike 15 kilometers, which was not imaginable several months ago. So we see really massive improvements up to complete healing, but we see also people which don't experience this hard experience. And the question is, not this hard is the wrong word, this impressive improvement, yes. Yeah. And the thing is, we've got to find out dosages, we've got to find out the length of treatment, and this happens day by day, yeah, I think anybody trying nicotine patch for himself or for herself should expect not too much, but everything can happen in between. Nothing happens, and I can become completely rid of the problem. Yeah.
And it's still a good idea also to keep your GP in the loop. Take your study to your doctor and be like, I would like to try this in case there's anything else going on with someone.
I just invite anybody to join these groups, because every new experience is worth and is of importance to find the way for right treatment.
This is brilliant. And as you said, this is not just for long COVID. This is also beneficial for people who are diagnosed with ME CFS and potentially fibromyalgia.
Fibromyalgia is the hypothesis the most. It's just, for me, one possibility which could be solved because genetic neurotransmission takes place in any of our cells, so that the imagination that blockage of this communication between the cells, between the nerves, is a very good explanation to other conditions like fibromyalgia and ME CFS. And anecdotally, I was in contact with a very prominent colleagues have been dealing for a long time with ME CFS, long before COVID did appear, and they gave it to their patients, and we saw, meanwhile, even in patients via net feedbacking to me, we saw massive improvements even in ME CFS. So that and especially in ME CFS, and meanwhile, it becomes clearer and clearer that it has to do with a primary viral infection, Epstein-Barr, for instance, or other viruses, and probably this might be the cure. Yes.
This is absolutely incredible.
Yeah, I hope so. I hope that it works.
Yeah, I will definitely share all the resources you mentioned in the description, so people can have a look, can try it out, and see for themselves what happens. Is there anything else worth mentioning about this topic? Anything we haven't said?
If you once once felt an improvement, go slowly forward, because you will evoke a new crisis if you overdo your trial to be normal. Don't waste your energy after improvement. Go step by step. Your health you're becoming health in a step by step fashion. It's not just pasting the patch and you become the one you've ever been before the COVID infection. So go slowly, give your body time to heal from the post-COVID situation, because if you imagine that you've been ill for such a long time, a lot of compensating and other reactions of your body take place. For instance, the mitochondriopathia or other somatic changes, which have to be reversed from a body within a time of weeks or months, might be.
Yeah, that's very
That's
good
it.
advice. Well, thank you so much
Thank
for your
you.
time, for your work, for everything you're doing. That was brilliant.
Let's hope. Time will tell.
Thanks. Thank you so much for watching this episode. Wow, it was incredible. So many information, and the best message I think I got to share on this channel so far, because it is accessible for everyone to try this. So I can highly encourage you, go do it. You have nothing to lose. Follow the groups, see what everyone else is doing, learn from one another, share your experiences. I'm thrilled and I can't wait to hear what it does for you. See you next time.